In this session, Dr. Roldan will emphasize the importance of learning about leadership and professionalism for your medical career and why it should be taught during medical school. Some background on Dr. Roldan, we're very honored to have her here. She is the Chief Executive Officer for Florida International University's Healthcare Network. In this role, she leads the clinical enterprise that serves the Academic Health Center, FIU campus, and the community. In addition to the CEO role, Dr. Roldan serves as Associate Dean for International Affairs for the Herbert Wertheim College of Medicine. Hope I said that right. Associate Dean for the Master of Physician Assistant Program and Professor of the Herbert Wertheim College of Medicine. Dr. Roldan, thank you so much for your time, and you can begin when ready. I'll get your slides up.
Yes, well, my pleasure, Ryan. Thank you so much, and welcome to all those that are joining us this morning. And first of all, I would like to applaud you. Because the reason that you have joined a conference such as this is that, you are thinking of your future, which is very important, and how best you can become competitive in such a competitive world, which is first and foremost medicine, but even more importantly, that it starts as early as medical school, and then obviously as you go on to residency, and then ultimately as you become a practicing physician. So one of the things I always say is that when I start a lecture such as this is that every medical school graduates doctors, but not every medical school graduate leaders. And there is a difference. To become a doctor, and I don't need you know all this much better than I do. I went to medical school many, many years ago. And it is basically, you're smart, you study a lot. All those, you do very well on your exams, and you get a diploma, right? It sounds easier said than done, right? But that's the way it is. However, to develop leaders and true professionals, to take them to the next level, that is truly that's truly a task. And right now, with everything that's been happening in medicine, medical schools are tasked to develop those leaders. And also, as you go into residencies through the graduate medical education programs, we're also tasked that before that you are out there and practicing physician, you have to be a leader, and you have to see how best you can place yourself in order to do all the great things that we're entrusted on, which is well beyond just the patient care. It also has to deal with patient safety, patient quality, patient experience. And it is through patient experience that that holistic approach that also we as physicians need to be trained in a holistic manner. Okay, so because of that, a few years ago, and I'm very happy to say that the Herbert Wertheim College of Medicine was at the table to developing what we call the EPAs. And the EPAs are the Entrustable Professional Activities. And what are those? Basically, these are discrete activities, and I'm going to go through all of them, discrete activities that are suitable for entrustment to a trainee after obtaining sufficient competency. So it is not anymore that we give a test and we grade you, and that is it. We have to make sure that you are competent in what we teach you. So at the end of the medical school, basically, every medical school would need to go through every of those competencies, which we're going to go through, and be able to check off the boxes that every single medical student is able to do that and be ready in the first day of residencies. One of the hardest things is, as we were developing these EPAs, is how to operationalize it, because it is not easy. It's not as easy as giving a test and again grading you. We have to make sure that you are competent and skilled in what you do and you can apply. So right now in medical schools, we basically are focused on what we call competency-based education and training. The 13 EPAs, which are the core entrustable professional activities for entering residencies. And by the way, I do encourage you to go through, to go to the AAMC website, where you can not only read about these different EPAs, but you can see how we have actually implemented them. Again, today we're going to focus on the EPA 9, which is the collaboration of being a member of the interprofessional team, which is where we focus on the development of the medical student as a leader and as a professional. So the 13 EPAs are as follows. First, be able to gather a history and perform a physical exam. And as you know, that starts very early in medical school. Next is prioritizing differential diagnosis. Not only do you have to go through the physical exam, but also you have to make sure that this is not a cause and effect. You have to think about other diseases that could be involved with finally your endpoint of the diagnosis of the patient. To recommend and interpret common diagnostic tests, that is very important. And obviously in the value-based world that we live in healthcare, it's important that we don't over recommend or over prescribed, but that we do it in the right, correct manner that provides value to the patient. Next is to enter and discuss orders and prescriptions, and that obviously again is alignment with the competency of getting to a diagnosis early enough to be able to serve the patients as they deserve. Document a clinical encounter on a patient record, and this obviously is the competency to be able to learn different EMRs, electronic medical records. That is extremely important. This is the world that you all will be living. It is not anymore the world I lived in, which was really paper. This is being able to go from one electronic medical record to another and being able to be competent in documenting in the patient record. Next is really communication, which is part of leadership and professionalism, to be able to provide an oral presentation and in a very prompt manner and be able to get to the endpoint quickly. Next is the clinical questions, to really form clinical questions where basically you would ask as part of the team those critical questions that again will take you to the endpoint or diagnosis. A handover, number 8, extremely important in patient safety. If you noticed every single EPA, you say, well, I'm able to do that, I'm able to do that. But the question is, are you able to work in teams? And in being able to work with teams is where, again, as we're going to discuss further in this talk, is all the qualities and skill set of a leader and a professional. Number 9, which is the one we're going to be focused on today, is to collaborate as a member of an interprofessional team. You all will be living and working in a team-based environment of healthcare. It is not anymore where the doctor's at the center and then the doctor surrounds himself or herself with a team. It is, we have a patient at the center, and in and around that patient is the team. The team, which encompasses not only the doctor, the nurse, the pharmacist, the social worker, etc. EPA 10 is recognizing when a patient needs urgent or emergent care. And that obviously is very important because we need to be able to know the level of care that the patient needs in order to serve them in a prompt manner and in a patient safety manner. Next is the informed consent, and obviously that again is important. This is why part of being a leader and a professional is that doctors need to be very good communicators and being able to translate and be transparent to the patients, but be able to translate from a very complex medical jargon, I would say, that we use, all the way down to what the patient can recognize and is able to understand. Next is the general procedures, to be able to perform just general simple procedures. And finally is to be able to identify those medical errors and to identify before you get to a medical error to make sure that you provide an environment of culture and safety. These are the Entrustable Professional Activities that even before entering residency, we all, as part of faculty in a medical school, need to check the boxes that you are ready, skilled, and competent to go out into the residency. Next slide, please. Number 4. So let's focus on how to work in teams. Well, first of all, what is an effective team? Especially in an interprofessional team, which is very easy, possibly, maybe not, to be in a team of all doctors because we all speak the same language. But how do you come into developing a team very rapidly when basically you all have the same mission, which is a patient, and which is to get to a diagnosis of the patient. So an interprofessional team is members of 2 or more professions, as I alluded to: nurses, physicians, community health workers, social workers, psychologists, pharmacists. Here at the Herbert Wertheim College of Medicine, our most important part of the curriculum is where our students work within these interprofessional teams, and they go out to the community to serve the underserved. Those individuals that cannot access the care, we take the care to the home, but we work in teams. In fact, we even work with police officers and advocates within the community, because we encompass what's called the social determinants of health, which is, again, the world you all will be living in, which is not only focusing on the pathology of the disease and diagnosing, but also looking at the rest of the environment that that patient lives in. So the qualities of leadership and professionalism are very necessary in order to work in teams and to be effective and improve health outcomes. Next slide, please. So what is leadership? Well, we all can go to the Webster Dictionary and say, okay, based on what Webster says, it's the power and ability to lead other people. Very straightforward, but how do we do that? How do we convince individuals? One of the a perfect example is what has happened in COVID-19. Doctors have been faced with a very, very intense level of hesitancy for vaccines, and we know that vaccines protect the public. So how do we convince? How do we communicate? How do we bring along that population to make them understand that that's the right thing to do? So good medical leadership is important to building high quality healthcare, and you'll see that in any type of, even a one-to-one with your patient, trying to convince them what is best for them. Next slide, please. How do we define professionalism? Well, professionalism is definitely a core competencies that you will be looked upon as you enter residency. They're going to want to see your personal statement. What have you done in medical school to have become a leader? How have you brought individuals to your team? How have you convinced your team for a betterment of an outcome? So that if you have that, you should highlight it in your personal statement as you enter residency. On the other end, unprofessional behavior, we understand that has caused a lot of medical errors, and it has even cost lives. We understand that unprofessional behavior of a physician, which is disruptive physician behavior, and or of any provider, has been a cause for medical errors. So it's really the responsibility of us as medical educators to train the future providers in leadership and professionalism, so that we reduce not only medical errors, we reduce morbidity, we reduce mortality, and in turn, we are really playing advocates to focus on reducing a $4.1 trillion healthcare spending. Next slide, please. So how do we focus on leadership and professionalism in your undergraduate, in your medical school years? First, we try to instill, and the reason that you went to medical school, and yes, we all want to help people, but there's other careers and other disciplines that help people as well. But it's really the conviction and that dedication and commitment to what we call lifelong learning. The physician never stops learning. Perfect example, again, COVID-19. Those of us that have been out, not only out of medical school for many years, I would say decades, and also out of residency, we had to go back to the books. We had to start learning again, reviewing virology, reviewing zoonotic disease, now with monkeypox, right? We never stop learning. So if you are willing to give up a lot of your life, or part of your life, and obviously it's not at 100% of the time, but at certain levels of your career, then you are right. You are a leader, and you will become a leader and a professional in this career. Lifelong learning, very important. System thinking. We just don't only look at one aspect, we look at the entire aspect and how they connect. We're constantly focused on quality improvement. We understand that medical errors is very costly in this environment, and we understand that even when we are the best, or a hospital system or a health system are at the top of their game, right? Are the best, have the best scores. Leapfrog is a sort of a report card for hospitals. We understand that we cannot sit in our laurels, that we have to continue in what that's called the focus of total quality improvement. And then we have to understand the insurance system and how all this plays a role. So again, that complexity of the healthcare system is extremely important to bring as part of your competencies and skills. And that is what we teach. And that is how you, again, focus. It doesn't mean that you're going to forget about all these things that you see here on the slide when you become a resident. On the contrary, you expand and you build on these qualities. Next slide, please. So what is leadership? And obviously, if I would be able to ask you, think of a leader, think of someone, and it doesn't have to necessarily be a doctor, right? Someone that you look up to because of the certain qualities that leaders have. Well, what are those qualities? First of all, focus on getting the best out of people. And this is why when you work in teams, it's not about you, it's about the team. And it's about what common goal you want. A leader is someone who's unconditional, who basically doesn't look at me or it looks at us as at the group. Leaders could be mentors and sponsors, and I will discuss a bit of the definition of one versus the other. They are ambitious, but they're always ethical, and they work with integrity. Again, they understand that they alone cannot make it, that any good positive outcome is because of a team. So the word I is not in the vocabulary of any leader. They have good attitude, and yes, you will have times that, where you're going to be very stressed, but that does not entail that you have the right to be nasty or not have a good attitude towards your team. And then they hold themselves, and they're role models. They hold themselves accountable. Next slide, please. In helping others, leaders are coaches. Again, you're role models, and you can be mentors and sponsors. Mentors is someone that basically guides you and tells you the good, the bad, and the ugly. They have tough love. And a sponsor is one that basically takes you to the next level of your career. And I hope that by this time, you all can actually close your eyes and think of mentors that have helped you to get to where you are today. They help others, they help others grow. Sometimes they really bring in part of their team someone that is even a lot smarter than they are. And that's a difficult thing to do, because as physicians, we are all looked up by a large population, and they make us think that we know it all, and therefore that we're the smartest of the group. But really, if you are a leader, you want to be surrounded by individuals that are even smarter than you are. They increase the self-esteem in others, and they motivate others to grow, and they work hard. They just don't leave it up to the team. They're part of the team. Although they're considered the leader, they're part of a team. Next slide, please. They're problem solvers. They don't see obstacles or challenges as a problem. On the contrary, they're always looking for the silver lining. And they always see obstacles or challenges as solutions, not problems. And this is why you see great leadership that has surfaced in the past 2.5 years in COVID. Those frontline physicians, those frontline providers that were there to say yes, even to the point that some of them are colleagues of mine, myself at the front line, I'm on the other side, so to speak. I am a few years, I've been in medicine for many, many years. And it was an honor. It was an honor, and I would say an honor, to be at the front line again, when I would have never thought that I was going to be at the front line, especially in a pandemic, which we had never seen. Next slide, please. So what are the qualities, again, of leaders? Self-awareness, one of the first things that you need to do, and right now, is to say, who am I? And what do I want to accomplish? One of the things that I say is, and we're going to take a look at it, is a pact. Write down your values. What are the things that are important to you? And your values, by the way, should never change, should never waive, because you're going to find yourselves with an MD degree. And an MD degree is a very solid, it carries a lot of value for the population. But you're also going to find yourselves in situations where People may be asking you to do things, and it could be a patient or it could be someone else. So it's extremely important for you to understand your values and to keep that very much as part of you. Humility is a big part. And yes, humility is sometimes very difficult in physicians, because as I just alluded to, it is very difficult when you have individuals around you saying, thank you, doctor, you're the best. Thank you, doctor, you saved my mother's life. You saved my life. But never let that really cover your eyes and saying that, you know, you have been fortunate, you have put in your competencies and your skill set, but humility is extremely important, because next time you can make a mistake. So the way that phrase, which I made a mistake up front, is extremely important. You're also going to learn that that is very important to reduce your, to be able to reduce the potential of malpractice. You know, lawyers will tell you, doctors, if you made a mistake, you're human, and to acknowledge your mistake is a lot better for them to be able to defend you. Next slide, please. Mentors, going back to mentors, these are trusted, experienced advisors. I bet you many of you have had mentors and hopefully have actually taken you to where you are today. It is not a counselor, he or she is a listener, but they help you, guide you to make your own mind. They're not coaches. They're basically there to really build your roadmap as you go into your career. Next slide, please. So what is the difference between the mentors and sponsors? Okay, sponsors is someone who helps you and your effort to advance your career. You're going to find those as you start going out in the real world, of someone that basically will say, you know, you're now a chief medical officer, but you have the qualities to be an operations officer, and you go up the ranks of a hospital. So that's what sponsors are for. So basically, as part of your career, you may need both of them. You need those mentors that you can trust, and they and basically can give you that tough love of where you're going right or where you're going wrong. And then you need the sponsors that basically will help you take you to your next level of the career. Next slide, please. So you have to ask yourself, so why am I listening to something like this at this level of my career? Well, first of all, leadership and professionalism will separate you from the rest. One of the things that you are now possibly looking after is, how can I basically have a good application for residency? As I just alluded to, and I'm going to start with what say with what I started. Every medical school graduates doctors. Not every medical school graduate leaders or professionals. And that is where you need to look into yourself, analyze who you are, what are the great things that you can bring to the table to be able to be part of the next generation of healthcare. A healthcare that is value-based, a healthcare that is focused on quality, a healthcare that is focused on teams, a healthcare that is focused on the patient first, becoming a leader that thinks of the system, thinks of others and not self. And this is how you will be basically just separated from the rest. How you articulate that, how you write that is extremely important. But the roadmap starts with knowing who you are and developing your own leadership style. Next slide, please. So what I would leave you with messages of how I built my roadmap. Lesson 1, face your challenges. Challenges are not obstacles, are not problems. They're opportunities. Act and move on. Take responsibility. It is okay to make a mistake, but to hide a mistake is a problem, and learn from them. Next slide, please. Lesson 2, seek mentors. They're there, and when they believe in you, they are going to believe in you unconditionally. They will give you tough love. I've had a lot of mentors in my career, and believe me, when they tell you you're wrong and you're not doing this correctly, it hurts. No one wants to be corrected, but that's really their goal. And again, knowing the difference between a mentor and a sponsor, and using both throughout your career journey. Next slide, please. And lesson 3, be persistent. The lifelong learner is persistent. I don't understand this. You need to persevere. You need to really get to that next level. Ask, continue to ask. Asking is not a problem. It doesn't mean it's a sign of weakness. If we would all be born knowing, we wouldn't have to go to medical school. We wouldn't have to go to residency. In fact, we wouldn't have to have continuing medical education. So ask and continue to ask. Continue to seek. Don't accept the status quo. The status, there's a reason why it's called status quo. We need to move. We need, if we would have been stuck in COVID-19, just telling the public, cover your face, wash your hands, and not seeking treatment, not seeking vaccines, not seeking the next level, where would we have been today? And again, I want to leave you, which is very, very important, very close to my heart. I am a lifelong learner. I continue to learn. If every day I don't learn something new, I have not given value to that day. So never, never stop learning. Next slide, please. So with that, it concludes my presentation. I hope you have enjoyed it. And Ryan, I think at this time I can entertain some questions.
Yeah, we are over time here, but I think we have time for one or two questions. If someone wants to pop them into the chat there, and if not, we can conclude. But thank you very much for that wonderful presentation.
Thank you. So I don't see any. I mean, they just have several questions on certificates and several questions on the access of the slides, and I think that they can access the slides.
Yep. And I think if you're on other sessions, that should be answered as part of this entire being part of this presentation, where how to access the slides.
Absolutely.
Afterwards.
So thank you so much. I wish you all great success. It's a wonderful career. It's very hard, but it's well worth it. And if I were to do it all over again, I will do it all over again. So best of luck, stay safe, and remember, be a role model. Thank you so much, Ryan.